Now from KWWL, this is the Steele Report.
So this week on the Steele Report, I wanted to bring in three local guests to really talk about kind of an update on what is happening right now, what's been happening with the coronavirus and COVID-19 in Black Hawk County and across the Cedar Valley. So here are my guests for today, and obviously they need no introductions as they're very well known and have been seen quite often during the pandemic here the last few months. So Dr. Nafisa Sisi Abonye is, of course, the director of the Black Hawk County Health Department, and she has done an amazing job on those, handling very tough questions, trying to be delicate about, sensitive about, HIPAA and not releasing too much information. But today we'll try to get some more information out of her as we kind of bring you update. Mayor Quentin Hart has been on the program, of course. In fact, both mayors have come in for the noon news several times here in the last few months, so we appreciate that. So Mayor Hart, thanks for taking the time to be here today. And Mayor Rob Green of Cedar Falls has also come in today to kind of bring us update on what's going on in his community during the pandemic. But I think we're going to begin today with Dr. Abonye and Nafisa, talk a little bit about where we are now compared to where we were, say, 7 months ago, and how do you think the county has responded? And obviously we're not out of the woods yet.
No, but before I begin, Ron, I just want to first thank everybody. This has been an incredibly difficult journey, but I want to start by just thanking the health department staff who work tirelessly, very dedicated and passionate individuals, and to our community leaders, our elected officials, and just to the overall community for supporting us, supporting our response, and also for trusting us as we respond to COVID-19. This trust is something that's very, very important to really be able to reduce the impact of COVID-19. And so we are tremendously grateful for that trust that you all have in us. Again, it's been a long journey. It's been a very difficult journey. I think about the number of deaths that have occurred in the county, the people that have been impacted by COVID and still have suffer the consequences, the health consequences of that, the business closures that we've endured, and the economic impact, and the isolation, and just the overwhelming information that has been coming and continue to come. And so I really, this is something that I really empathize with the community. It's been a difficult one, but we will get through this. We will get through this. I think one of the most important things about Black Hawk County is our resiliency. We've seen how also the protests in the midst of COVID has occurred, but now we're also seeing community engagement. People are starting to ask questions about what can they do more to be part of the solution and the problem, and people that are proactive in the preventative measures that they're taking to reduce the spread of COVID-19. So that we are grateful, and so this is something, we're not out in the woods yet, but we do need to continue to be alert. But my message to the community is continue to be alert, continue to practice those preventative measures, continue to wear your mask. But we will get through this. The pandemic will end, but it will require all of our efforts in order to curtail the spread of COVID-19.
Nafisa, thanks very much. You mentioned masks, and we have 4 masks for everybody here in the studio, and we're not wearing them right now because we are social distancing. In fact, the mayors are actually about 8 feet apart as they are on our main set. So, and Nafisa's over way on the other side of the studio. I'm, as you can see, back in Mark Schnackenberg's world back here in the forecast center. So we're really exercising our social distancing. Mayor Hart, what has been, do you think, for the city of Waterloo and the community, the biggest issue? Because obviously COVID has really impacted the African American community too. So what do you see as the biggest issue that we've faced here in the last 7 months?
Well, this whole 7 months, 8 months has been a roller coaster ride. We been in a spot where unfortunately we have been shown on CNN and other places of increasing rates to, taking some of those rates down at the same time. But through all of this, I first want to give a special thank you to Dr. Nafisa and her staff so much for their leadership. It's not easy getting in front of people, dealing with the pandemic where if you do this, you're 8 feet apart, then you have to be 6 feet apart, and where things are constantly changing. But one of the things I believe that helped the most is the fact that all of us, our local governments, our elected officials, our school officials, and county health professionals, they all brought us together so that we can have communication and consistency in the type of message that's being sent out. And so that education and communication, I believe, has been very important to making sure that we can give our community the necessary resources they need. And last but not least, I think the community's patience as well. It's not easy. Just the other day, I was with my daughter, taking her to school, and my daughter's like, "Daddy, are we gonna have trick-or-treating this time?" And when I said what the CDC recommendations are, she was like, "Oh." So everyone in our community, from the youngest of our children to our seniors in the community, have been greatly impacted, to our businesses and child care providers. But having a unified voice to help us to be able to communicate to everyone has been something that's been so critical over the course of the last 7 to 8 months.
Mayor Hart, thanks very much. Mayor Rob Green, a unique situation in Cedar Falls, particularly since you have a university community nearby. So what has been the biggest challenge, do you think, 7 or 8 months now down the road?
One of our biggest challenges, similar to what Dr. Nafisa stated, was just maintaining the public trust and being able to express guidelines and suggestions based on changing new information. We know a lot more about COVID-19 than we did back in March and April. And so being able to react responsively and to do the things that we need to do without underreacting or overreacting has been a major priority for all of our communities. So I'm especially grateful to the help of Dr. Nafisa and Mayor Hart and Sheriff Tony Thompson for their mentoring, because I came into this not expecting or anticipating that this would be one of the primary challenges of my first term. So with that said, looking at the university campus and the other community partners and interest groups in our city, probably my biggest concern on the student end is making sure that they feel safe and comfortable, that their parents feel safe and comfortable with having them here in Cedar Falls, and that we're taking the appropriate actions, whether it's through requiring of social distancing on campus, President Nook instituting the mask mandate on campus, and us following suit here in Cedar Falls. Those sorts of things are going to be vital for maintaining a campus that's healthy, and also where students aren't led into online courses, that they can complete a college education in person, which has so much value to their growth.
All right, thanks, Mayor Green. Yeah, I mean, a long way to go yet. In fact, we have gone so far into the program, we need to take a break real quick. We'll be right back to talk more about the Cedar Valley COVID-19 response and what's ahead in just a moment. And welcome back to this week's edition of the Steel Report, as we're talking about COVID-19 in the Cedar Valley. And one of the things I wanted to talk about with Dr. Nafisa Abonia, the director of the Blackhawk County Health Department, is the guidance that the governor has gone away from recently. How do you view that? Because, in fact, maybe I'll let you explain it. If somebody's wearing a mask and you're wearing a mask, tell me how that's working, because there's no quarantine required anymore. How did you feel about that?
Yeah, according to the state of Iowa, when two individuals are wearing a mask and one of them is infectious, and they both wore the mask correctly, the other will not need to quarantine for 14 days. So that guidance is very different from CDC. And we did ask where did that information come from and the rationale behind changing the guidance. So the state informed us that they looked at data in Wyoming and Nebraska and also saw that in school districts there was less transmission of COVID in schools that required the usage of face masks. So that was their rationale, Ron, and the policies that Wyoming and Nebraska are implementing.
And mayors, you haven't had an in-person meeting for quite some time. We've been seeing these things on Zoom or Microsoft Teams or whatever mechanism you're using. Mayor Hart, how long is that going to continue?
It just depends. You know, I actually have to say Mayor Green had worked very hard and created an overall matrix that is used for internal decisions within his departments. And so we've kind of adopted some of the portion of that matrix, but with the city of Waterloo. And we take a look at community spread, we take a look at internal spread, and we try to make decisions based upon those numbers of whether or not we'll bring someone in. So we have 1 or 2 council members that have been present, and we had a few other council members decide not to stay for other reasons as well, because you have to take a look at that. So we don't know what the future holds, but everyone is there and they're present.
Well, there is still the ability to attend meetings through Zoom, and we invite the public to attend that way if they prefer. We've just switched with our last council meeting, and then tonight's meeting will do the same, where we have in-person. In our council dais up at the front, we have plexiglass shields between each council member and each staff member. We also have our chairs socially distant, so they're at least 6 feet apart for the public, and we have a limited number of public seating within the building. So we do want to be careful with building occupancy and making sure people aren't bunched together. The public does have to wear masks while in the building for council meetings, and we're keeping masks on up at the dais as well. On the plus side for this, as challenging as COVID has been, it's given us quite a few new capabilities and technologies that, for me as a technologist, I would love to see us continue indefinitely. The ability for the public to attend virtually, for our people who are coming in, if we have developers or outside experts, they don't need to necessarily travel to Cedar Falls anymore. They can participate with us via Zoom. Because there's no additional cost outlay at this point. We've already spent the money for the new tech and the new capabilities. So going forward, we will continue watching the counts. If we do have a spike or a re-increase this fall, we'll have to take that into consideration if we're going to go just to physically distance or excuse me, remote only meetings. But as it is for now, with our numbers looking fairly solid, slowly dropping down, I would like to see us continue on the track that we're on for at least the near term.
Blackhawk County, how would you describe the current situation? Has it leveled off to a degree that you're comfortable with the schools being in session? And tell us a little bit about your fears about the possibility of something coming back. But how is it going right now, do you think?
So first, I have to thank also our school officials who have done a tremendous job. Just following our guidance. I remember very earlier on where we were having discussions about requiring face masks or not, and they followed public health. And so I thank them for that, because now, as the state has communicated, they're seeing less transmission with schools that are requiring face masks. So that was a very important measures. I know that it was a really difficult time, and parents were concerned. But I also want to thank the parents out there who are educating their kids about wearing face masks and who are following the protocol necessary to protect the students and also the teachers and administrators. Yes, very early on we were concerned because we wanted to make sure that the reopening of schools was done in a very effective manner. There wouldn't be any point in reopening schools and children getting sick, administrators or teachers. And so that was really a priority for us, to work with the superintendents to review those guidelines, to update them promptly and just being readily available to them for any questions. And so we still have weekly meetings with superintendents just to keep them abreast of what's going on at the state level. But also they give us, it's also the opportunity for them to update us with what's going on in their schools, what they're seeing, and what we can do better. So this has been a great partnership, and it's a partnership that I look forward to continue regardless of whether we have a pandemic. It's really the overall health of our student population, our teachers, our administrators that matter, and it's critical.
Well, thank you very much. Yeah, I mean, the school districts, boy, have done a terrific job, I think, overall. There's no doubt about that. Mayors, let me ask you, what are the biggest concerns that you're hearing from your residents of your cities? What are they most concerned about right now? I mean, we got to COVID season, you also got flu season coming on too. So what are you hearing mainly at City Hall? Mayor Green, go ahead.
Well, we're looking for concerns and questions as we put together the mask mandate for the city, about a month ago. Some of the concerns were regarding civil liberties and whether cities had the right to institute a mask mandate. So I feel like we've expressed or explained that as well as we possibly can, that cities do have that authority under the Home Rule Amendment. And I would again note that I have requested that the governor state specifically in an emergency proclamation that cities don't have the authority to issue emergency proclamations regarding masks. As we read the proclamation now, it doesn't prohibit us from taking this action. So that's been something that's come up from residents, and I feel, as I said, we've addressed it as best we can. Other concerns are about just the risk level of COVID, or whether it's a threat, what metrics we're using. I tend to steer now toward what I call the Harvard scale, which is Mayor Hart alluded to earlier. That's what I use to determine our posture for the city, and it's based on cases per 100,000. So it gives us a way to level our score with and compare with other counties around the country. So I've gotten some pushback on that we should be just considering hospitalizations and ICU usage. But until there's an effective vaccine, and until we can more realistically and positively contain community spread of coronavirus, I'm still going to consider the spread counts, the new daily cases, as one of the most important figures.
Mm-hmm. Yeah, thanks very much, Mayor Green. Mayor Hart, besides the usual complaints that you receive as mayor of Waterloo, what are you hearing most about as far as COVID is concerned?
Usual complaints, this in an unusual time. One, just the overall health and well-being of our citizens, the events that we hold, and whether or not we have mask mandates and those, and trying to make that determination. But also hearing from our small businesses that may not have been able to receive some of the dollars that have been coming through on the federal, the state level. If you're a small business and you have just one employee, I'm hearing last night from a friend whose fiance had to move her business. Then hearing about the impacts to our minority businesses with the large portion that are actually in some of the fields that are most directly related to COVID, and being able to function at this time, to people not being able to pay rent. So there are a lot of ongoing issues. And then not to mention the long-term health impacts to people that are suffering from COVID. So we are doing our best to try to be responsive in those situations. And sometimes there's a lot of criticism that may come with trying to err on the side of caution. But all of us have to remember that we're not the enemies to one another. The enemy is the virus, and our ability to be able to fight that together is going to determine our long-term success for the future. So thank everyone for your patience, but just remember we're in this together.
Thank you, Mayor Hart. We're going to take another break, come back right here in just a moment to talk more. Also, remember, our shows are always online on kwwl.com. We're coming right back. And welcome back to this week's edition of the Steele Report, as I'm talking with the mayors of Waterloo and Cedar Falls and also Dr. Nafisa Sisi Obonia of the Blackhawk County Health Department about the current status of COVID. And Nafisa, one thing we wanted to bring up right now, really that probably the most important thing is we still have to be very, very cognizant of prevention, particularly with COVID and the flu season coming up. So what advice do you have for people?
Well, community, please let's remember the 3 W's. Wear your mask, wash your distance, and wash your hands frequently. So we still need to practice these preventative measures. These are also preventative measures that will help against the flu. But with COVID, we know we don't have a vaccine yet. And so we want to make sure that people continue to practice these preventative measures. And please get your flu vaccine. Please have your children vaccinated, get your flu vaccine, make sure that your parents, the elderly population, are getting their flu vaccines. And so I really would like for the community to continue to practice these preventative measures as we head towards COVID and flu season.
Mayor Hart, real quickly, are you satisfied with the way that Tyson has responded following the initial problems they had out at the plant?
Well, the ability for us to be at odds on how they need to protect their workers to the communication levels that we have been able to have through Blackhawk County Health and our local Grove Cedar Valley. I'm very pleased about that progress. So very thankful for the measures they put in place and the understanding that pro-health means to be pro-business, and those two go hand in hand. And also for Blackhawk County Health and our office to be able to have conversations with other businesses and take a proactive approach to being able to work together with our businesses on this end instead of on the back end trying to help take corrective actions.
Yeah, because Mayor Green, really Blackhawk County, a lot of the businesses in both Waterloo and Cedar Falls and the surrounding communities just cannot afford to really have another shutdown where they might be closed for weeks or months. That was a real problem, wasn't it?
Right, and that's one of the messages I want to get out, especially for residents and for business owners. When we implemented the mask mandate, it wasn't to restrict, it was to preserve. We wanted to make sure that businesses could stay open, and when we saw the bar closures a few weeks ago because of the spike due to the especially college level use of the bars, we can prevent that, we can limit that possibility from happening by following the other principles that Dr. Egboni mentioned, the 3 W's, wear your mask, socially distance or watch your distance, and wash your hands. Those are such simple precautions, but we would not be having the discussions we are having today and the difficulties today if we were doing this from the outset.
And Nafisa, real quickly, I've got my mask here. I think you might have yours over there. So properly wearing one, you need both your nostrils and your mouth.
Yes, please cover your nose and your mouth.
And Mayor Green, your new police chief, Craig Birdie, told me he didn't want his officers being the mask police, right?
Right, so we have to be really careful how we engage with the public and what the perception is. While it's important that our public safety professionals are demonstrating proper procedures and that they're complying with our mandate as well, we do have provisions for first responders and people in what we call tactical situations or dynamic situations to not have to wear masks. So you may see them out without them on, but for the most part, they do need to set the example as well.
When the vaccine, let's say when the vaccine finally comes, Nafisa, do you believe it should be mandatory, and will you require, like for example, people in the Blackhawk County Health Department to get that vaccine?
Well, I think first of all, it's important for me to emphasize, as Mayor Hart stated, the enemy is the virus. And I've seen so often conversations about requiring or mandating. Public health has made some great achievements through immunization. It's to protect the health of our community. And so I think that this is not really something that we should even second guess. The most important thing right now is for us to continue to have trust, for us to continue to inform the community. And when those protocols are released, I will communicate with the community and inform them, provide the updates and all the necessary information that we are getting at the state level. So I think the most important thing is that we continue at this moment to practice these preventative measures that we have in front of us.
Well, thank you so much for coming in and taking the time to give us kind of an update. We'll do this a little more frequently down the road if you want to come in. We appreciate that. So all of you, the 3 W's, do the best you can because you're protecting yourself, your loved ones, everybody around you. That's it for this week on the Steel Report. Thanks for watching.